All right, so welcome back to the program, and Sadia has something for us.
Yes, when we were still on the newspaper, we had a column where they spoke about flood. All right, like two various newspapers. Then I said today we have something to talk about on randoms, talking about the tenants, the landlady, a drama between the landlady and her tenants. The landlady requested for rents from her tenant who is currently battling with a flooding. So I think apart from that story, we still have a foreigner saying he ignored the advice of people when he told them he was coming to Nigeria. So I don't believe he had bad experience at some points coming to the country. And now he now remembered that, so people told me about this when he told them that he told them about his intention of visiting Nigeria. So these are the two topics we would like to talk about on random. So go nowhere, stay glued to your television set. I will bring you randoms Ogochukwu Mobuno. Welcome to Randoms, where we hit the streets to hear what Nigerians really think about issues shaping our lives, including we are going to take a bit of some trending stories making waves online today. So I am your host, Ogochukwu Mobuno. We'll be looking at all of the stories, and to be part of the stories we're going to be sharing today, including hitting the street, please make sure you're watching on DSTV, channel 365, or Star Times, channel 276. Or better still, because I always want to hear your feedback, please make sure you're using the Global TV handle. It's Global TV NG on YouTube and be part of our discussion today. All you need to do is just subscribe to Global TV NG on YouTube. Click on this bell like icon. It's going to notify you whenever I will come your way so you don't miss out on any of our programs, including up-to-date news. And voila, Global Television is on DSTV, channel 3. It's also on a free TV, I beg your pardon, so you can watch Global Television on free TV. All you need to do is to download the app using your iOS device or Android device. Just make sure you go to your Play Store or your Apple Store, download free TV, and you're going to be seeing Global Television right there. All right, let's hop right into the topic of discuss for today. The first one we have here is tenant blast landlady over rent demand amid flooded compound. A video making the rounds on social media captures the moment a tenant confronted his landlady after she allegedly demanded rent despite severe flooding in the compound. In a now viral clip, the visible frustrated man questioned why tenants were being asked to pay rent while the property remained flooded, making movement around the compound difficult. The incident has sparked mixed reactions online, while some social media users backed the tenants, arguing that landlords should ensure their properties are habitable before demanding rent. Others insisted that tenants are still bound by their rental agreement unless otherwise stated. The video has reignited conversations about landlord responsibilities, property maintenance, and tenants' rights, especially during the rainy season. Let's take a look at that video.
Muna see the kind water where landlady get mine pull leg. They come demand for us rent. Muna see water. Muna see water. See water. She get mine pull leg for this kind of water. They come demand for us rent. See landlady. Muna see her. They come demand for us rent. Get mine. They come demand for us rent. Get mine. They come demand for us rent. For enter water, enter this kind of water, they come here, come demand for us rent. We can landlady. We can landlady.
All right, so I have a serious problem with that guy that was screaming, why are you coming to collect rent? See how the landlady is coming out to collect rent amidst flood and all of that. I have a problem with that guy because why are you being rude? Why are you trying to this entitlement mentality that we have in this part of the world. I don't like it, honestly. So should the landlady not come out to collect her rent because it's everywhere is flooded? By the way, you came to the house, you paid your rent at first when you were moving in because you liked the compound, and now I cannot come and collect my rent because everywhere is flooded. Whose fault is it that it is flooded? Honestly, this is entitlement mentality. It is very wrong. So please, if you know you are living in a house that is flooded right now, it is not your landlord or your landlady's problem. You came to the house, you came to that compound, you liked it, and that's the reason why you stayed. That's the reason why some persons will tell you, if you want to get a house, make sure you go during rainy season, so you understand the place you are living, so you know if that place is a flooded environment, is a flooded area. You also know how the house is, how strong the house is, because there are some houses, whenever it is rainy season, you start to see algae building on the body. When you even go into the compound or inside the room or the apartment you want to rent, you get to see that some places are affected by water, maybe too much water on the ground or something. So you see that the cement is peeling off, or maybe the paints are already peeling off or wearing out. So that's the reason why most persons will tell you, they're advising you, please make sure you get an apartment during the rainy season, because it's going to help you, it's going to save you a lot of stress. But now you have rented the apartment, you've lived in that apartment for how long God knows, and you are complaining because your landlady came to collect her rent. Please pay your rent. I said you are looking for a different reason not to pay your rent, but please, if you are due to pay your rent, why not? Please pay your rent. All right, let's take a look at some comments from social media. And we are taking the first one here, Family and Mercy. And Family and Mercy said, well, there are times for everything, and the landlady is so insensitive to ask of her rent in these hard times. I'm a landlord, so don't come for me. I won't even do this. Well, this is personal. This is personal, I must say. That is my view, that is my thought. If you have yours, please drop it on the comment section, and that's why the comment section is free. It is open, so you can actually drop your thought. Let's banter. But then again, this person's view is personal. Family and Mercy, I'm saying this to you. Your view is a personal thing. So for the fact that my house or the apartment where I built is flooded, shouldn't I take rent? If you do not take rent because, oh, you feel people are going through this, people are going through that. What if the landlady actually lives in that same compound? That means she's also going through that stress or whatever it is you're going through at that time. She's going through the traumatic experience. What if she needs the money because her children were already sent out of school? What if she needs the money to fix some things in the house? So there are so many things. Let's not be emotional. A lot of times Nigerians really treat cases with emotions, and it's not right. Most times when you use your emotions, we don't get it right. So please drop sentiment, drop emotions aside, and make sure you treat things as it comes. The landlady is human. She is human. She needs money for something. She wouldn't come outside to demand for money if she knows that, oh, she doesn't have any rights to. Except if you want to talk to her, maybe your property has been affected or some things are damaged already, you can come out, meet the landlady. I'm sorry. Understand that you need to collect your rent. Understand that my rent is also due, but please, can you bear with me at this time? Because there's so many there are different ways to communicate. I think we don't just know how to communicate in Nigeria. We don't want to learn how to communicate. And you know one thing, this is one of the disadvantages of social media. You just take up your phone because nobody bought it for you. Because most times when you see people post things and you're like, why did you post this kind of thing? You go to their comment section to me, maybe ask them. And the next thing is, nobody bought a phone for me. Nobody bought data for me. It is my phone, it is my data, and I have the right. Come on. Until they start arresting people and beating them for acting like it is all right for them to do some things. Please, let us learn. This is the disadvantages of social media. You cannot just come out there, disgrace and harass your landlady. What if she gives you a quick notice? The next thing you're telling them, oh, I'm right. I know my rights in the law, blah, 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 and all of that. Please, let's stop it. Let's stop it. This is really, violation, and it's not right. If it's personal to you, Family and Mercy, is a very beautiful thing that you are a bit sensitive at that point, not to lay off your tenants or ask them, demand for your rent. But please, if someone else is not doing it, please let them do what is right for them. So I appreciate your concern, all right? Second is coming from Fikuna Demi, and Fikuna Demi says, flood is government's problem. Rent belongs to landlord. So allow the government to treat their problem, and me, who is the landlady or the landlord, allow me do my own job. I think it's this person just spelt it out in few words. So I think it's clear for everyone to understand, except you want to also be sentimental or too emotional at this point. All right, the last comment for today is coming from, or for this topic rather, is coming from Vic Graham, and Vic Graham says, I don't understand before. Okay, I said I don't understand. If rent due, you no go pay before. Very simple. If your rent is due, won't you pay? Whether rainy season, whether dry season, whether harmattan, whatever it is, name it. Even if it's snowing, so you will not pay because of the environment is dry, it is harmattan, so we cannot pay rent. Come on now, please. You will pay your rent. If it's due, you will pay it. What if you are looking for an apartment? This person gave you a shelter. You already have a shelter. I don't know if your house is flooded, whatever it is. You can actually communicate properly. I understand it's a hard time. It's a trying time for you as a tenant. But also know that your landlady might actually be going through what you are going through. So she knows. All you need to do is just to communicate to her. Just that's the perfect thing and the right thing to do, instead of disgracing her, calling her out on social media, right? So let's learn how to use the social media right. Understand we all want to be content creators and what have you not, but please, let's create the content with clarity. Create that content with a bit of maturity, okay? Let's move over to the next comment, the next topic for today. And this one, a foreigner has reacted after arriving in Nigerian airport despite online warnings. A foreign traveler has shared his first experience after arriving in Lagos, saying the process was much easier than he expected, despite the warnings he had seen online. According to him, immigration was smooth, officials were friendly, and no one asked him for anything. He added that his only issue was waiting for his luggage, which had already been taken off the baggage belt. Describing the experience as super easy, he said his arrival in Nigeria went without any problem. If I had a bell, I'm going to ring it out like, 3 goes out for Nigeria. So, we've seen so much things. And when I was going through the story, one thing came to my mind. I said, yes, every country have their own problem. Let's know that and know peace. Every country have one thing. If you go to the country where you feel like it's the most peaceful country, there are some persons who are not happy with what the government is doing. There are some persons who are not happy about the policies of the government. There are some persons who are complaining and they are wishing they are somewhere else. So let's know that. You know how human beings are eat at table with their wants and needs. Just know that, so you can never satisfy everybody. So this is a foreigner testifying of the goodness of Nigeria and the Nigerian airport. In as much as there have been several threats and warning not for him not to even move to Nigeria, he said, no, I have to go see for myself, because seeing is believing, which he did, and I think he got a very good report, a positive one. So please, what I'm going to say right now to beg Nigerians is, please, we all have our problems, different country, even that country abroad, USA, UK, Canada, and what have you not, that you are dreaming of going to, we understand. They also have their problems. So please, can we stop or reduce the rate we actually share our problems on social media and expose the country and make it look like it's one bad country? Because a lot of persons, when you hear Nigeria, they deprive you of so many things. We've heard people go to the airport and they deprive them. Someone was traveling to Canada and she made a stop at I can't remember the country right now, but then they sent her back because why? They looked at her passport and she was having this green card, Nigeria. So it's more like you're a threat. They don't want to know you. They don't want to know anything about you. If you are coming from Nigeria or you're in Nigeria, you are more or less a threat to anybody, which is not a good one. We are beautiful people. We are so habitual. We're so warm.
Wicked landlady. Wicked landlady.
All right, so I have a serious problem with that guy that was screaming, why are you coming to collect rent? See how the landlady is coming out to collect rent amidst flood and all of that. I have a problem with that guy, because why are you being rude? Why are you trying to, this entitlement mentality that we have in this part of the world? I don't like it, honestly. So should the landlady not come out to collect her rent because it's everywhere is flooded? By the way, you came to the house, you paid your rent at first when you were moving in because you liked the compound, and now I cannot come and collect my rent because everywhere is flooded. Whose fault is it that it is flooded? Honestly, this is entitlement mentality. It is very wrong. So please, if you know you are living in a house that is flooded right now, it is not your landlord or your landlady's problem. You came to the house, you came to that compound, you liked it, and that's the reason why you stayed. That's the reason why some persons will tell you, if you want to get a house, make sure you go during rainy season, so you understand the place you are living, so you know if that place is a flooded environment, is a flooded area. You also know how the house is, how strong the house is, because there are some houses, whenever it is rainy season, you start to see algae building on the body. When you even go into the compound or inside the room or the apartment you want to rent, you get to see that some places are affected by water, maybe too much water on the ground or something. So you see that the cement is peeling off, or maybe the paints are already peeling off or wearing out. So that's the reason why most persons will tell you, they're advising you, please make sure you get an apartment during the rainy seasons, because it's going to help you, it's going to save you a lot of stress. But now you have rented the apartment, you've lived in that apartment for how long God knows, and you are complaining because your landlady came to collect her rent. Please pay your rent. I said you are looking for a different reason not to pay your rent, but please, if you are due to pay your rent, why not? Please pay your rent. All right, let's take a look at some comments from social media. And we are taking the first one here, Family and Mercy. And Family and Mercy said, well, there are times for everything, and the landlady is so insensitive to ask of her rent in these hard times. I'm a landlord, so don't come for me. I won't even do this. Well, this is personal. This is personal, I must say. That is my view, that is my thought. If you have yours, please drop it on the comment section, and that's why the comment section is free. It is open, so you can actually drop your thought. Let's banter. But then again, this person's view is personal. Family and Mercy, I'm saying this to you. Your view is a personal thing. So for the fact that my house or the apartment where I built is flooded, shouldn't I take rent? If you do not take rent because you feel people are going through this, people are going through that. What if the landlady actually lives in that same compound? That means she's also going through that stress or whatever it is you're going through at that time. She's going through the traumatic experience. What if she needs the money because her children were already sent out of school? What if she needs the money to fix some things in the house? So there are so many things. Let's not be emotional. A lot of times Nigerians really treat cases with emotions, and it's not right. Most times when you use your emotions, we don't get it right. So please drop sentiment, drop emotions aside, and make sure you treat things as it comes. The landlady is human. She is human. She needs money for something. She wouldn't come outside to demand for money if she knows that, she doesn't have any right to. Except if you want to talk to her, maybe your property has been affected or some things are damaged already, you can come out, meet the landlady. I'm sorry. Understand that you need to collect your rent. Understand that my rent is also due, but please, can you bear with me at this time? Because there's so many there are different ways to communicate. I think we don't just know how to communicate in Nigeria. We don't want to learn how to communicate. And you know one thing, this is one of the disadvantages of social media. You just take up your phone because nobody bought it for you. Because most times when you see people post things and you're like, why did you post this kind of thing? You go to their comment section to me, maybe ask them. And the next thing is, nobody bought a phone for me. Nobody bought data for me. It is my phone, it is my data, and I have the right. Come on. Until they start arresting people and beating them for acting like it is all right for them to do some things. Please, let us learn. This is the disadvantages of social media. You cannot just come out there, disgrace and harass your landlady. What if she gives you a quick notice? The next thing you're telling them, I'm right. I know my rights in the law, blah, 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 and all of that. Please, let's stop it. Let's stop it. This is really, violation, and it's not right. If it's personal to you, Family and Mercy, is a very beautiful thing that you are a bit sensitive at that point, not to lay off your tenants or ask them, demand for your rent. But please, if someone else is not doing it, please let them do what is right for them. So I appreciate your concern, all right? Second is coming from Fikuna Demi, and Fikuna Demi says, flood is government's problem. Rent belongs to landlord. So allow the government to treat their problem, and me, who is the landlady or the landlord, allow me do my own job. I think this person just spelled it out in few words. So I think it's clear for everyone to understand, except you want to also be sentimental or too emotional at this point. All right, the last comment for today is coming from, or for this topic rather, is coming from Vic Graham. And Vic Graham says, I don't understand before. Okay, I said, I don't understand. If rent due, you no go pay before. Very simple. If your rent is due, won't you pay? Whether rainy season, whether dry season, whether harmattan, whatever it is, name it. Even if it's snowing, so you will not pay because of, the environment is dry, it is harmattan, so we cannot pay rent. Come on now, please. You will pay your rent. If it's due, you will pay it. What if you are looking for an apartment? This person gives you a shelter. You already have a shelter. I don't know if your house is flooded, whatever it is. You can actually communicate properly. I understand it's a hard time, it's a trying time for you as a tenant, but also know that your landlady might actually be going through what you are going through, so she knows. All you need to do is just to communicate to her. Just that's the perfect thing and the right thing to do, instead of disgracing her, calling her out on social media, right? So let's learn how to use the social media right. Understand we all want to be content creators and what have you not, but please, let's create the content with clarity. Create that content with a bit of maturity, okay? Let's move over to the next comment, the next topic for today. And this one, a foreigner has reacted after arriving in Nigerian airport despite online warnings. A foreign traveler has shared his first experience after arriving in Lagos, saying the process was much easier than he expected, despite the warnings he had seen online. According to him, immigration was smooth, officials were friendly, and no one asked him for anything. He added that his only issue was waiting for his luggage, which had already been taken off the baggage belt. Describing the experience as super easy, he said his arrival in Nigeria went without any problem. If I had a bell, I'm going to ring it out like, three goes out for Nigeria. So, you know, we've seen so much things. And when I was going through the story, one thing came to my mind. I said, yes, every country have their own problem. Let's know that and know peace. Every country have one thing. If you go to the country where you feel like it's the most peaceful country, there are some persons who are not happy with what the government is doing. There are some persons who are not happy about the policies of the government. There are some persons who are complaining and they are wishing they are somewhere else. So let's know that. You know how human beings are eat at table with their wants and needs. Just know that, so you can never satisfy everybody. So this is a foreigner testifying of the goodness of Nigeria and the Nigerian airport. In as much as there have been several threats and warning not for, for him not to even move to Nigeria, he said, no, I have to go see for myself, because seeing is believing, which he did, and I think he got a very good report, a positive one. So please, what I'm going to say right now to beg Nigerians is, please, we all have our problems, different country, even that country abroad, USA, UK, Canada, and what have you not, that you are dreaming of going to, we understand. They also have their problems. So please, can we stop or reduce the rate we actually share our problems on social media and, expose the country and make it look like it's one bad country? Because a lot of persons, when you hear Nigeria, they deprive you of so many things. We've heard people go to the airport and, they deprive them. Someone was traveling to Canada and she made a stop at, I can't remember the country right now, but then they sent her back because why? They looked at her passport and she was having this green card, Nigeria. So it's more like you're a threat. They don't want to know you. They don't want to know anything about you. If you are coming from Nigeria or you're in Nigeria, you are more or less a threat to anybody, which is not a good one. We are beautiful people. We are so habitual. We're so warm. We're so welcoming. So please make sure that you're portraying the country in good light outside there on your social media pages. Wherever it is you find yourself, make sure you are a good citizen. That's the only way they can start accepting us. We are beautiful people. Can't you see? Someone is coming to say we are good people. He loves Nigeria. He arrived and everything went seamless. And you there, you are complaining. You will complain, NDLA did this to you, immigration did this to you. The problem is whenever we Nigerians, whenever we are in the airports, we kind of somehow act very rude in our own airport, because you just feel like, oh, I'm this, do you know who I am? You are not supposed to do this, you're not supposed, please, just comply, do what you're supposed to do, and they will let you go. But then when we arrive outside, airport outside, we are very calm, we are very patient. Why? We have to ask ourselves that. So please be patriotic. Be a patriotic Nigeria. Well, let's take a look at that video from this young man from the abroad.
Officially everything done. I'm walking into a new country. I am in Nigeria, guys. I just arrived here in Lagos Airport. I see all these videos online, people warning you, Nigeria immigration, baggage check. Well, I tell you, it was smooth, it was easy. Nothing happened, only smiles, no one asked me for anything. People were super friendly. Okay, I had to wait for my bag for about 40 minutes. I just sat on a chair and bags were coming and mine was not coming, so I started sweating. Then I figured out they took it already off the belt, so I found it in the end. I must say my arrival here to Lagos, Nigeria was super, super easy.
Right, so it's such a beautiful moment to hear that someone out from outside the country actually has something positive to say about Nigeria. So please stop scaring people. All right, so let's portray ourselves in good light outside there on social media. Stop acting like Nigeria is one bad country. We live in the bush, or we are not enlightened, or we are not, well mannered. Please, it's wrong. All right, okay, let's take a look at some comments, because you know what? In as much as we try to make it look beautiful out there, people still have something bad to say. But whatever it is, let it not deter you, let it not make you feel bad, all right? First comment is coming from Olajide LXG, and Olajide says, I just saw a comment from someone who has never passed the airport condemning the video. Some people don't just like good news coming out from Nigeria. Thank you so much. Olajide is a patriotic Nigeria, okay? Next one is coming from Bolu Wolf, and Bolu says, to be fair, the crowd has calmed down. Many arrival last week was the calmest ever. No one asked for anything apart from one NDLEA guy who we had a long friendly chat. Plus, he asked politely and not directly. I'll give it 9 over 10 overall. I think we have to get a bell. Honestly, when I see good comments like this, I'll just ring the bell so you understand that you actually did something nice. We love reviews like this. All right, the last comment for today is coming from Cash Football Takes, and this person said, Nigerians, you try to take a positive review of your country for once. It's a sign that things are changing bit by bit. Let's wait till he posts another review about what he sees on the road. All right, thank you so much. Yes, so today I know you want to ask, are we not going out on the street? Why not? We cannot leave you guys on the street. You know how much I really love going out on the street. That is where the real show is. All right, so today we are asking a question on the street, and this question that generates serious debate: should skill acquisition replace university degrees? I know you might be asking or wondering, why am I saying this? As more youths in Nigeria, people turn to vocational skills, digital careers, and entrepreneurship, many are beginning to question whether a university degree is still the only path to success. So, what do Nigerians think? We are going to find out what Nigerians think. Do you think getting a degree is the only path to success? Do you think going to school is the only key to success? Well, if you ask me, I would say, I don't think so. There are so many keys to success, but there's something that education does to us, all right? There's something that the 4 walls of schools actually help. It helps to shaping our mindset, shaping you. It's a culture. It gives you a different hoping, and that's the reason why you put a successful man who is not educated, and you put a man who is educated but then not rich or not successful in business or whatever. You definitely have to somehow tilt towards the educated poor man, because there is something education does. So that's for me. I just feel like, yes, the university degree is not the only path to success, but at the same time, it is not bad getting that. It's like one feather added to your red cap. So we're going out on the streets to hear what Nigerians think about this question.
World, skill acquisitions already gives a certification. Like you have the carpentry, you have the medicine, you have different certifications. that still makes one skill. But to have a certificate from a university and got no skill is like a full emission into the atmosphere. And we're looking at zero emission in the world today. So I guess that skill is stronger than certificate. And it's unfortunate, a lot of people are carrying certificate, but they are just certificated fools. So we should look beyond certificate and look more at skill. Thank you.
Believe education is very, very important, right? So, but the situation in Nigeria now makes some people, they don't want to go far in education. In terms of skill, like my own son is in this school in Uyo. So what I'm facing there now is not easy for me. You know, every this thing that they are taking now, what do they call it? Maybe when they go to escort or whatever, I don't know how I put it. The lecturers, everything's all about money now. The guy, I know how much that I have invested there, just under 1 year. So education is not easy now. That's the thing. Like this thing that they give to me, it's an admission paper. You see it. So, but I'm trying to see if I can be able to afford it. So everything in Nigeria now is all about money.
If you ask me, the truth is both should, in fact, both are the best. Once you are done with your school, even while you are in school, just engage yourself in one skill or the other. That's just the gospel truth. Because the truth is, if you're waiting when you're done with school, and after which you go and engage yourself, it may be too late. So the truth is, as it stands now, even while you are in school, just engage yourself. The barbing, the stylist, maybe you want to learn nursing or whatever. So even while you are in school, just engage yourself in it, and it will help. Thank you.
Acquisition is good. Acquiring a skill is good, but we still need education. We still need education because education, to me, is a kind of enlightenment. Do you understand? So without education, it will be difficult for people to engage, even in the skills acquisition. You still need education there. So education should not be excluded in the system, or to be compared with skill acquisition. The both are all good, but none should be taken after one. Do you understand? Education is good because when you are educated, you become enlightened. You know more about things. You know how to handle, to solve your own problem, to solve the problem of the community. You know how to help your country to grow. You contribute to the growth of the nation. So to me, education is a good. Is not to be removed from the system, or to be compared with skill acquisition is good, actually, and is helping the country as it stands now, because now we have many people, many graduates that are unemployed. So what is helping our nation now is mostly the skill acquisition. So skill acquisition is good. Like in our business arena now, you can see people acquiring skills like carpentry work and the rest. Those skills will help them. You can see that even the skills acquisition, people use it to sustain their family, to keep the family going. So they are all good. They both are good, but we need education, because education will give you more enlightenment, to give you more knowledge on what you want to do. That's my own contribution. Thank you.
All right, so welcome back from the street. Of course, a lot of persons have different opinions. That's the opinion of people, and that's the beauty of it all. So I would like to also see your opinion. I would like to hear them. I would like to read them. I would like also have a conversation on the comment section. So all you need to do is to please, let's put up the comment section again. It's Global TV NG on YouTube. Be part of it. Let us know what you think. Global TV NG. A lot of people ask, Global TV? No, not just Global TV. When you go to YouTube, you see different Global TV, but Global TV NG is the word. Together, not separated. And please drop your comments and we're going to see you, of course, by 6:30. Let's know what you think about it. All right. You have heard the opinions. Some believe practical skills are the future, while others insist that university education remains essential for career growth and professional credibility. But where do you stand? Should skill acquisition replace university degrees, or should both go hand in hand? Share your thoughts on social media platform. Until next time, this is Randoms, where every opinion counts, and I am your host, Ogotko Mobner. Bye for now.
All right, so welcome back to the program now. We've been listening to Ogochukwu as she took us through some of the trending discussions. Now, over to Sadia.
Yeah, so you hear what she said. We spoke about the landlady and her tenant saga. Spoke about the foreigner who came into Nigeria despite an online advice telling him not to visit Nigeria because of some attitudes they believe Nigerians have. But to me, Nigerians, we are friendly enough.
Yeah, Nigerians are very friendly.
Yeah, we are friendly. Our reception in Nigeria is very good.
Right.
Yeah, that's what, when you go to other countries, you would hardly see them. But when you come to Nigeria, we just see you as you are also a Nigerian like us. So my advice is, you don't dent the name of Nigeria. Yeah, don't dent the name of the country Nigeria and Nigerians. So I think we should be fair enough.
Yeah.
And then moving on from that, I want us to talk about health issue.
Yeah, health is
agenda, the priorities. I think we've made that. We spoke about that before.
Absolutely. Body. Stay. I'll be right back. All right, so welcome back to the program. The health condition in our country, Nigeria, is something that calls for concern. We keep seeing where for very illnesses, some persons fall into distress. They have to run out of the country because the investments that we're making in health seems to be very troubling and sometimes very low and not up to the standard. The United Nations says 25% of our budget should be for health, but is that the case in Nigeria? maybe sometimes no. Welcome back to the program. It's still Global Morning Weekend Edition. My name is Ubongo. Sorry, and as usual, we have Sadia is still with me as we continue the conversation on the program. Sadia, welcome to the program.
All right, good morning once again, and welcome to Global Morning Weekend Edition, the place where stories come alive as usual, ideas spark, and the moment that matter takes center stage. Together with Ubongo Soro, I am Sadia Okubu, will be your host for the next few minutes. DSTV channel 365 and Star Times channel 276. You can also watch on YouTube using at Global TV NG. So, like Ubon stated earlier on this segment of the program, we'll be talking about health agenda. Health agenda is a structured plan or policy framework that outlines a government, organizations, or international bodies' health priorities, goals, and strategies for improving public health outcomes. It identifies the most urgent health challenges. As we all know, we have health challenges in Nigeria, sets implementation targets, allocate resources, and guideline decisions making in the health sector. Examples include the National Health Agenda, such as Nigerian Health Sector Renewal Investment Initiative, global health agendas led by organizations like World Health Organization, regional health agendas such as Health Agenda for Americans or any other countries, meaning the assessment of implementation of priority issues. This phase refers to evaluating like how well the health agenda has been carried out, the implementation assessment, the major health problems or challenges that requires urgent attention as the priority issues. Then the assessment of implementation, that is implementation assessment, examines whether health policies and programs are achieving their intended objectives. Then we have the key areas usually assessed, that is policies, evacuation. We checked whether planned programs were actually implemented. Then we have the vaccine campaign, the primary healthcare expansion, health insurance program, like we have in Nigeria, NHIS, the maternal and child health and interventions, funding, and then resource allocation, whether sufficient fund was provided, whether funds were used efficiently, availability of medical equipment and drugs, then health workforce capacity. That's the availability of doctors, nurses, and community health workers, training and retention of personnel, distribution between urban and rural areas. Because in some rural areas, we don't have doctors, we don't have nurses, and you see some, they are not even what to write home about. So we look at the measures, which include number of health facilities, geographic coverage, availability of services, equity, and service delivery. So I don't know if you can just pick it up from there.
Yeah, absolutely. When it comes to metrics to rate our healthcare, like you were, just stating some of those metrics, we see that these are global standards, and if we must compete as a country, we must take the health care sector of our country very important, because health tourism is one of the very major means where we see people traveling out of the country time and time again, to be able to get it. But if we are able to fix it in Nigeria, a lot of issues will be fixed.
All right, so joining me via Zoom is Dr. Murtala Bagana, Niger State Commissioner for Health. If he has joined, a good morning. All right, so before he joins us,
like as I was saying, we have to be very intentional about our healthcare sector, because when we are able to put our healthcare sector in place and put it in order, a lot of issues, a lot of confusion, a lot of things will be solved. The amount of monies that are being used in the country daily, amount of manpower where people travel out to go and seek for medical attention is alarming, right? If you go to the embassies, you see many Nigerians who are queued up, and why they are there is because they are seeking for visas to travel, to be able to get healthcare services, because people want to live and then people want to see their people leave. So this is something that we've seen time and time again. And as a people, we have to be more intentional in our approach towards the healthcare sector. Like I was mentioning to Anita yesterday, we saw President Bola Ahmed Tinubu commissioning Bola Ahmed Tinubu's complex at the Federal Medical Center in Abuja. So I mentioned to Anita, yes, we have the secondary healthcare response system, like the Federal Medical Center. We have the Federal Medical Center, FMC. We have the hospitals and all of those, but more than that, the primary healthcare center that should be the first, port of call for any eventuality is not being, attended to as much as many Nigerians are still complaining that they are ill-stocked, they don't have the necessary medication, they don't have the right professionals. There should be the first response system. Many Nigerians have even lost hope, right, approaching those medical facilities like the primary healthcare center. So these are issues that we should be able to lay out as a country and be able to solve it and make Nigerians understand that primary healthcare centers are very important, and through government coordination and the things we're able to do.
All right, so a number of health facilities, geographic coverage, affordability of service, equity in service delivery, monitoring and evaluation, that's the check. Do you show the check?
Yeah, they do. I remember when I was in Calabar and I was working for a radio station, I did a United Nations project on health, during the COVID period. And it was the monitoring at that period was superb. The monitoring and supervision of it was led by the DG, Director General of the Cross River State Primary Healthcare. I don't know if it's center or facility for primary healthcare Cross River State. There was a lot of monitoring to check the various healthcare centers if they have staff who are on call, right, to attend to people, because sometimes you could even see people that are on night duties will not come. In their mind, they'll say they will not have patients in the night. But what if you now have the patients in the night? So there will be nobody to attend to them. So there's a lot of, in these kind of critical sectors, you need lots of monitoring and supervision. In these kind of critical sectors, you need monitoring, you need supervision, and you need a good dose of this kind of supervision. And you don't just leave things and we go to play. Sometimes we could even go to, I'm more interested in primary healthcare center, because this should be like the first port of call. This should be like the first place where people approach. This should be like the first place where a lot of cases are able to be taken care of. But we end up not seeing that. So what we see now is that everybody wants to run to the Federal Medical Center, to the teaching hospitals, forgetting that the primary healthcare center, should offer such services to them and to Nigerians. So these are questions that concerns that Nigerians continue to raise as to how intentional we are with our healthcare system. Because if we don't have an healthy population, it will affect the other things we do, right? Sometimes issues like that could easily be treated and solved through early detection and the right medication, is not solved, and sometimes it leads to loss of lives and property. And these are human lives that could have contributed to the economy of the nation. So it just lays a bare foundation that it is very important, and it is something that Nigerians must not take for granted. It's something that the government must not take for granted. We must start to see quality investment. We've seen some elite investments. We have some very good hospitals, but at what cost? These are issues that Nigerians that can an average Nigerian walk into an hospital and receive quality healthcare. Sometimes you even get into some hospitals, then they will book you for 2 weeks. What if you die before that 2 weeks?
They tell you to go and come back.
And you don't blame them, because they are short staffed. A medical doctor may need to see up to 80 patients in a day. It doesn't. There are global standards to this thing, but because they are short staffed, 2, 3, 4 medical doctors attend to the whole community, it shouldn't be so.
For example, something happened back then in my state where we lost a life. The woman was pregnant, and then they didn't know that she was pregnant. Then they carried out an operation, like they operated her for something, I've forgotten, was it appendix or something like that? So when they started, there was lights. You know, Nigeria now, they will bring lights now, and then later they will take lights. No generator, no solar system. So the course of operation, they waited for like 2 hours, no lights. So the husband of the deceased now said, okay, I would buy petrol. They said the gen is faulty. To cut the long story short, we lost the woman after bleeding. Before the real doctor could arrive, not unknowing to the people there, those ones even performing the surgery were not even the real doctors. What am I trying to say here? What I'm trying to say is our health sector now, I don't know for private sector, but talking about government health sector, we don't give it that priority anymore. Some doctors will be on duty and then they will just leave and they allow IT students, I don't know how they call their own there, but to me I think that's IT students, to take charge of our patients. You can see issues such as the surgery aspects. You allow IT students to operate on a patient with such situation.
That's quite.
So I don't know our government-owned hospital. I don't know how some of our doctors behave.
Right, that's.
If an IT student is an IT student, you leave him, just carry him or he or she along to show them the procedures. Give them animals to operate and not human beings.
Like I said, it still boils down to the challenges that we're facing with supervision, implementation, because there should even be, if a patient dies and it is found out that it was like as to complacency or negligence, a doctor could lose a license. Yeah. And that's a means of livelihood. That's many years of studies, and so you understand how valuable your license is to you, and you do not want to lose it. So it means you are going to put in your best behavior to stay on the job, right? So these are issues, but because in Nigeria, if somebody just dies, everyone will say, oh, it was the will of God. People just forget about it. So some persons have not really learned their lessons, and we could see time and time again. But we also have to cut some doctors the slack. We've seen doctors who have been so tireless in their approach to issues. We've seen doctors who, in the middle of the night, you call them to respond to patients, some at their personal cost. We've seen doctors who have sought, help for their patients and all of that.
All right, so I think Dr. Murtala Bagana has joined us, if I'm not mistaken. So if you can hear us, good morning, Doctor.
Good morning.
Nice to have you on the show today.
Thank you. Eid Mubarak.
Eid Mubarak. Hi, family. I'm here to receive my ram, even my colleague, Ubong Usoro.
Thank you so much. Your ram will be waiting for you in Mina.
All right, no problem. So a quick one, let's get started. All right, what is meant by National Health Agenda?
Yeah, okay, good morning, everyone. I think I want to use this opportunity to wish all Muslim faithfuls Eid Mubarak, and thank you for the opportunity to be on the program. The national program is as simple as I want to highlight it. What we currently have under the leadership of Mr. President, His Excellency Bola Ahmed Tinubu, and being managed by the coordinating minister of Health and Social Welfare, Professor Ali Mohamed Pate, is what we call the Health Sector Renewal Investment Plan. The Health Sector Renewal Investment Plan is a project that is broadly divided into two. One is an aspect that talks about the basic care provision funds and all the instrumentality of the National Health Act. And this is to be coordinated and managed from the Office of the Coordinating Minister of Health and Social Welfare through what we call an emergency delivery unit, which is SWAP. SWAP means sector-wide approach initiative. So that is one part of this Nigerian health sector renewal investment initiative. The other aspect is the industrialization component. So the industrialization component is basically saying, how do we begin to save foreign investment by unlocking opportunities within the local manufacturing? And there is specific initiative that manages that. And that is exactly how I will explain the entire health sector initiative. So like I mentioned, it is made up of two components: the basic care provision funds, which is managed within the sector-wide approach, and also the Nigeria Industrialization Plan, which is basically unlocking opportunity for medical industrialization. So those are the things that form the Nigeria Sector Renewal Investment Initiative. So I think that is the agenda at the federal government level. And this is exactly how it is cascaded down the state. And I'm sure in the course of our conversation, I will be able to explain exactly these two components. What are the components within the basic care provision funds? Who and who is doing what? And what are the components around the tertiary care and also the medical industrialization?
Okay, thank you so much, Doctor, for joining us. What's your assessment of the Nigerian healthcare system? Your general assessment? You've been around in the sector for a long time, because many Nigerians feel we've not done enough.
I think let's come, back to basis, and maybe people will appreciate the journey that His Excellency President Bola Ahmed Tinubu and the Coordinating Minister of Health, and just the same way from the perspective of Niger State government, former Governor Mohammed Umaru Bago. Where are we coming from? We are coming from what I consider an inverted pyramid. Inverted in the sense that the typical health architecture of Nigeria is a pyramid. So what it means is, at the bottom of the pyramid, we have the primary healthcare centers, the primary healthcare services, This should be able to cater for 60 to 70% of the population. Then if there are issues and cases that are complicated, then it gets referred to secondary care. And from secondary care, that is what, of course, we call the general hospitals across the 36 states and FCT. And in advanced cases or specialized care, then individuals are now meant to access care at the tertiary level. But is that the case? No. So what His Excellency President Bola Ahmed Tinubu met is an inverted pyramid where fewer people have trust on the level of the primary healthcare services that we are offering. And even for a common headache, people access care at both secondary and tertiary. So like I mentioned, 60 to 70% of the population, and a lot of our population are at the rural level, they are supposed to access care at the primary health care level. Then, 10 to 20, 20 to 30, then only 5 to 10% should actually seek for care at the tertiary level. But with this inverted pyramid, a lot of the burden now gets shifted to the secondary and tertiary. Even for a common headache, people walk freely into our tertiary hospitals, tertiary centers to access care. So what did the coordinating minister, what he immediately came in, he undertook a holistic assessment because he has been ready for the job. And the assessment came up with various approach to what to do to fix the problem. So for that, he has entrusted different agencies with the responsibilities to ensure that we invert back the pyramid the way it should be. And that gave rise to the 2023 to 2027 Nigerian's Health Sector Renewal Investment Initiative. What is it that we will do with the primary health care? So the primary health care revitalization, making sure that, we fix the problem of ineffective, inefficient, and poorly coordinated spending at all levels. So if we fix that, making sure that resources are available from federal through the Basic Care Provision Fund and all the gateways, the NHIA gateway, the National Primary Care Gateway, the emergency care through the emergency medical transport system, that resources get down directly to the facilities so that people will begin to have faith in our primary health care. In Niger State, His Excellency Mohammed Umar Bago has taken up boldly. He is a champion of the Nigerian Health Sector Renewal Initiative. And to do that, it is encapsulated within the new Niger Health Agenda to say, okay, since people lost faith in the primary health care, let's fix the primary health care. So we have started the whole revitalization of the primary health care system, working with our development partners, working with all the federal institutions, and also the Federal Ministry of Health and the Social Welfare to begin to fix the primary health care. What we have done so far is we have been able to take our primary health care to what we call the standard level 2 primary health care. This standard level 2 primary health care is a primary health care with a perimeter fencing, with all full complement of services, with accommodation for staff to ensure that services are delivered. And it's the same thing we are doing at the secondary level and the tertiary level. So yes, your question is absolutely on point. So the issues we are trying to fix is to ensure that we invert this pyramid. But we are not stopping at that. We are also saying, what is it that we can do because of the cost of commodities, supply and drugs? Can we begin to engage through a private sector initiative, private sector players, development partners, and the urge G institutions? By the G institutions, I mean the Gates Foundation, the Gavi, the Global Fund, the Global Facility Financing of the World Bank, to say, how can we unlock all the potentials within the medical space? There are a lot of potentials we are missing. We are missing potential around research. What is it that we need to do? We are missing potentials around the supply chain. What is it that we need to do to ensure that commodities get to the last mile? We are missing potentials around local manufacturing of drugs, commodities, and supplies. So these are some of the things we are doing in order to reverse the trend. But the most important elephant in the room is the issue around, in doing all this, we have vulnerable groups, vulnerable population. Are we going to leave them like that? No. So His Excellency President Bola Ahmed Tinubu has also come up with an initiative within the Ministry of Health and Social Welfare to ensure that we also take care of these vulnerable groups through the health insurance system, through the HOPE PAC initiative, and through also, as recent as a program that was launched by Her Excellency, the First Lady of the Federal Republic of Nigeria, which is the Community Food Bank. These are all initiatives within the health sector renewal framework to ensure we take care of this group. Lastly, the human resource for health. As we speak, we have not met, by all standards, the complement of the health workers that should be driving this initiative. The food soldiers, the most hardworking health workers. In Nigeria, the ratio of doctor to 100,000 population is 23, as against the global standard of 100. So we are not even there. What is it that we need to do to encourage that our health workers remain within the country? Because there is, there is this term, the Japa syndrome. The Japa syndrome is not only external, it is also within. A lot of the health workers, doctors are leaving rural communities to urban centers. It will interest you to know that more than 50 to 60% of the entire workforce, when it comes to doctors, are in Lagos State. Just one state out of 37 states in Nigeria. That is an internal Japa. So these are some of the initiatives within the Office of the Honorable Minister of Health and Social Welfare. And this is exactly the same template that I have also undertaken as the Honorable Commissioner for Health in Niger State, within the framework of the new Niger Health Agenda, to also drive the policy and the initiative of Mr. President.
So, talking about the health agenda of Mr. President and what you have done in Niger State as a Commissioner for Health, are health policies reaching rural communities effectively?
Yes, absolutely. Absolutely. Let me just start with this basic agenda of His Excellency, former Governor Mohammed Umaru Bago. When he came on board, he realized that there are basic problems within the space that needs to be fixed in order to get this health policy and programs down to the grassroots level. One of the challenges we met on ground when I came into office, I just came in, I think barely 6 months ago, was inefficient governance and coordination of all programs across board within the partner space and within the ministry. So in Niger State, we have over 1,500 primary health care facilities scattered across 25 local governments. We have 22 secondary health facilities, what we usually refer to as the general hospitals. Then we have 2 tertiary centers. One is federal, the Federal Medical Center, BIDA. One is state, the IBB Specialist Hospital. But the bulk of our responsibility is at the community level. So we have a community-based approach that is culturally sensitive to our people. So what did we do? We engaged the traditional institution, the custodian of our culture and heritage, on driving the health initiative. So on a quarterly basis, there is what we call the task force meeting on primary health care and immunization that ensures that the traditional leaders under the leadership of the Emir of Kagara, who also is the chairman of Traditional Leaders Council on Primary Health Care and Immunization in the entire North Central Nigeria, to ensure that all the policies that are coming from federal are cascaded down to the primary health care level, to the community level. And how are they involved directly? There is what we call the World Committee, the World Development Committee on Health. In each of our focal basic health care provision facility, there are 274 of them, and it has increased actually just a few weeks to a few months ago. These community leaders are at the center of decision making on how business plans are developed for primary health care service delivery. So they get funding on a monthly, quarterly basis. And once these resources come to the facility, they sit down to develop a business plan on what to do with these resources. Do we have ad hoc staff to fix and pay their salary? Are there equipment that need to be procured? Do we engage in drug revolving fund? Are there some maintenance that these are some of the resources that they are using to fix this problem? On a quarterly basis, some of these facilities get 600,000 per month or 800,000 to fix basic issues within this facility. This is different from all the other essential commodities and supply that comes from the state government and our partners, ensuring that there are no stockout of whether it is vaccine or commodities at that local level. So yes, there are programs that cater for community-based initiative. Lastly, we have an initiative which, like I mentioned, within the Basic Health Care Provision Fund, we call it the Community Health Program. This Community Health Program are residents of communities. They could be community health officers, retired nurses, or even people with little or no knowledge of health. They are trained to move from one household to the other to ensure that essential commodities are being provided to household and encouraging household to improve on their health-seeking behavior and refer them to facilities, so that you don't stay at home and you are sick and you are not accessing care, and encouraging them, providing health promotion and counseling to households to ensure that they also seek medical care at primary health care level. These are some of the responsibility of these community health workers at this rural level.
Challenges that slow down the implementation of health policies in Nigeria. You mentioned earlier when you were speaking the basic, that is the pyramid is divided into the basic and the secondary levels of healthcare. What are some of the challenges that are militating against the progress of our healthcare system in the country?
I think one of the biggest challenge that we face as a country within the healthcare space is not necessarily lack of resources. Even where there are resources, data has shown that, yes, I understand that our expenditure total budget as compared to the GDP is around 2.8 to 3%, as against the global standard of 5% of total budget expenditure. But if with the little that you have, do we have an effective governance that manages those resources? I have this popular say that more is not better. Better is better. You know, the idea that people would say, give me more, give me more, give me more. But how are you even spending the little? It is only when I can guarantee effective, equitable, and quality distribution of even the little you have that I can entrust you even with more. Yes, we have healthcare financing as a major challenge. And as a country, we need to be honest with ourselves. Healthcare is not charity. Healthcare service delivery is not just social services. Healthcare delivery is expensive. And we have to look ourselves in the eyes to say, it is expensive. Yes. But all fingers are not equal. Those that have should be able to pitch and contribute their fair share to encourage those that don't have in the time of need to be taken care of. And this is the kind of policy His Excellency Bola Ahmed Tinubu brought into. Do you know how many Nigerians know for a fact that within the 24 to 48 hours of road traffic accident, snake bite, fire disaster, any emergency injuries, that you can actually access care for free, regardless of your social strata, race, economic power, that these services is available to you as a Nigerian, as a resident, for free? How many people are aware of that? In designated facilities, a lot of Nigerians are not even aware of this. So, healthcare financing is one of our major challenges. The second one is the human resource for health. I want to make this narrative, and it's very clear, and until we begin to address that, then we will not solve the problem. You can build all you can in terms of a facility. In the most remotest community, if there is no doctor, you cannot move the health indices of that community, that local government, or that state. And the health indices of Nigeria is a collective health outcomes from each and every communities, local government, and state. So you need a doctor in that facility. A lot of our primary health care centers and in some communities, the secondary facilities lack the complement of health workers, doctors, nurses, pharmacists, medical lab scientists to be able to effectively implement on the health renewal initiative of Mr. President and by extension, His Excellency, former Governor Mohammed Umar Bago, the governor of Niger State. But even if there is no facility, if you take a doctor to a rural community, studies have shown that you can actually change the health indices of that community with the presence of a doctor, even if he or she is actually implementing services from his bedroom. So the second biggest challenge that we are having is a discussion around human resource for health. Doctors are in droves leaving the country for greener pasture. Are there incentives that we encourage them to? Their reward is not, they are not ready to wait till they go to heaven. Doctors, teachers, their reward should be in Nigeria. Their reward should be in Niger State. And that is exactly why the present administration of His Excellency Mohammed Umar Bago is paying attention to ensuring that we have doctors across Niger. Just of recent, last month, His Excellency approved through the Executive Council memo a program we want to initiate in Niger State. The name of the program is FLASH. For our listeners, let me exactly explain what FLASH program is all about. FLASH is Flexible Locum Appointment Scheme for Health Workers. FLASH, F-L-A-S-H. This is just saying that, is it possible for us to engage, starting with doctors, on a locum basis and post them to rural communities? Is it possible for us to ensure that, like you have just rightly shown on the screen, that is one of our level 2 primary health care center. Is it possible to have a dedicated doctor at this Senator Idris Ibrahim Kuta Primary Health Care Center? One of the best, if not the best in the country. That a doctor should be there. The doctor can actually provide services on a local basis. Is it possible for us to incentivize doctors that are posted to rural communities, provide them with car loans, provide them with housing loan, ensure that they have a call duty vehicle, provide them with a befitting accommodation, encourage them to work within these rural communities? This initiative, by the grace of God, will fully be implemented in the coming weeks and months in Niger State. We are saying that enough is enough. Whether you like it or not, our doctors are living and they are talking to us, but we are not listening. What we are trying to say here is, how can we come on the same table with doctors to provide, opportunity for local? A doctor can decide to work for 3 months, 6 months, 9 months, 12 months, but we will ensure that within the period they are working, as they are leaving, we are replacing them. But to ensure that there is continuum care in all our facilities, both at primary, secondary, and tertiary. At the tertiary level, you were just showing a very, important initiative of His Excellency, Former Governor Mohammed Umaru Bago. That is the Porter Cabin, a 60-bedded, state-of-the-art Porter Cabin, one of the best in the entire West African sub-region. What we are saying is that facility can be moved to anywhere. We know for sure that we have security problem in Niger State, but we are saying that that should not stop us from ensuring that we provide adequate health services to our people. So what you just showed is a fully automated Porter Cabin with full complement of equipment, beds, monitors, and also staffing that will ensure that on a regular basis, individuals are admitted at that level of care, which is the tertiary healthcare system. So lastly, one of our major problems is coordination. I think this is where kudos should be given to the Honorable Coordinating Minister for Health and Social Welfare. Governance coordination is one of the major issues, because if you don't have a coordinated approach to resource allocation and spending, then it will be difficult for you to implement programs, even down to the local government level. So the Honorable Minister, through the sector-wide approach, came up with an initiative that ensures that all resources are put together, all programs are put together under one umbrella, one plan, one voice, one M&E, and of course, at the end of the day, one outcome. We do not want fragmentation, verticalization of different program policies. So these are three things that I feel, if well addressed, can fix the entire healthcare system in Nigeria and by extension, Niger State. Healthcare financing, human resource for health, and ensuring that there are effective governance and coordination across all programs and resource mobilization.
Thank you so much, Doctor. Nice having you on the show. I wish you would be in the studio whenever you're in Abuja so we can discuss more because of time.
Thank you so much. Yeah.
Absolutely. Thank you so much for speaking to us this morning on the program. We wish you all of the best, and we hope to see, like you mentioned, and I just said, maybe being a beacon and the rest of Nigeria learning from the states as to our healthcare system.
Thank you so much. Like I mentioned, more is not better. Better is better. That you have more things without efficiency does not make services better. Even if you have little, just like we are doing in Niger, you have to make it more efficient, effective, and equitable for the entire Niger Light. Thank you so much, and I'm happy to, join you in Abuja anytime I'm given the opportunity.
All right, thank you so much. All right, so let's go for a short break, and when we come back, the show continues. Stay with us.
With Global Morning, your daily guide to
In an age of breaking news, you need a trusted source that prioritizes accurate, factual, and unbiased reporting. This is AM News, and I am Ubong Usoro.
On Global Television, Our news is rooted in verified and authoritative storytelling that keeps you educated, informed, and enlightened on all the issues that matter to you. I am Sadia Yakubu. This is Midday News.
You can trust a multi-platform news broadcast real-time and fast-check stories for all the big local and foreign headlines round the clock. I am Ramsey Enoch Agbo. This is News Express.
Our array of anchors delivers the news to our teeming viewers, breaking it down with context and perspective. This is News Cycle on Global Television. I am Anieti Patrick.
And the flagship news is your hub for the day's most engaging stories. This is News Prime, and I am Jumai Manson.
Did you miss any of our news rounds? No worries. Catch up at 10 p.m. and midnight, 7 days of the week. I am Mukhtar Kasim.
Global TV is on DSTV channel 365 and Star Times channel 276. We're active across all social media platforms at Global TV NG.